Low back pain, housewife case. Lumbosacral strain and sprain 95% versus disc herniation 5% in Dolphin Medical Doctor Clinic. Mrs. Johnson, 47 years old, female patient with 3 beautiful children. Good morning, Mrs. Johnson. I understand you've been experiencing back pain. Can you tell me more about it?
Yes, doctor. My lower back has been hurting for a few weeks now. It started when I was lifting a heavy laundry basket. The pain hasn't gone away, and sometimes it gets worse when I bend or sit too long.
I see. Let me ask you this. Does the pain stay in your lower back or does it travel down your leg?
Most of the time, it's just in my lower back, but sometimes I feel a little pain going down my right leg.
That's very helpful information. Based on what you've told me, there are 2 possible causes for your pain: a lumbosacral strain or a disc herniation. Let me explain the difference so you understand why your back is hurting and what we can do about it. Why your back is hurting. First, let's talk about a lumbosacral strain or sprain, which is very common. Why it happens: when you lifted that heavy laundry basket, you may have overstretched or overworked the muscles or ligaments in your lower back. Think of it like pulling a muscle in your leg. It's painful, but the pain usually stays in one area.
Why it hurts?
The muscles or ligaments in your back are inflamed, which causes pain and stiffness, especially when you move or sit for a long time.
That makes sense. So the pain is just from overworking my muscles.
Exactly. Now, let's talk about disc herniation, which is another possible cause.
Why it happens?
Your spine is made up of bones, and between these bones are soft discs that act like cushions. If you lift something heavy or twist your back the wrong way, one of these discs can bulge or tear. When that happens, it can press on nearby nerves.
Why it hurts?
If a nerve is irritated by the disc, you might feel sharp pain that travels down your leg. This is called sciatica.
So the difference is whether the pain stays in my back or goes down my leg.
Exactly. That's one of the key differences. Let's go into more detail so you can fully understand the differences between strain and herniation. Here's an easy way to think about it. Lumbosacral strain sprain pain stays in the lower back. It feels like a dull ache or stiffness. It's worse when you bend, twist, or lift something heavy. There's no tingling, numbness, or weakness in your legs. Disc herniation and pain can start in the lower back, but often travels down one leg. It feels sharp, like an electric shock. You might also feel tingling, numbness, or weakness in your leg or foot. Sitting, coughing, or sneezing can make the pain worse.
I see. So the leg pain might mean it's a herniated disc.
That's right. Based on what you've described, it sounds like your main issue might be a strain, but the occasional leg pain makes me want to check for a mild disc herniation. Let's do a quick exam to find out more.
Why these diagnoses matter?
Understanding why you're in pain helps us decide the best treatment. For example, if it's a strain, we focus on reducing inflammation and letting the muscles heal. If it's a disc herniation, we'll work on relieving pressure on the nerve while your body heals the disc over time. Why the treatment plan works.
What kind of treatment will I need?
Great question. Let me explain why each step of the treatment is important. Rest, but not too much. Why? Resting gives your back time to heal, but staying still for too long can make your muscles stiff. Gentle movement helps your recovery. Heat or ice? Why? Heat relaxes tight muscles, while ice reduces inflammation. Stretching and gentle exercises. Why? Stretching keeps your back flexible and prevents stiffness. Strengthening exercises build the muscles that support your spine, so you're less likely to get injured again. Posture and lifting techniques. Why? Learning how to lift properly and maintain good posture prevents future injuries. For example, bending at your knees instead of your waist protects your back. Medications. Why? Over-the-counter pain relievers, like ibuprofen, reduce pain and inflammation, helping you move more comfortably.
Why recovery takes time. How long will it take for my back to feel better?
That depends on the cause. For a strain, most people feel better in 2 to 4 weeks if they follow the treatment plan. For a herniated disc, it might take 4 to 6 weeks or even a few months, but most people recover without needing surgery.
So it could take a while, but I can recover with the right care?
Absolutely. Recovery takes time, but understanding why we're doing each step will help you stay consistent and get better faster. Next steps. Here's what I'd like you to do. Start with some gentle stretches. Use a heat pack for 15 minutes at a time to relax your back muscles. Avoid heavy lifting for the next 2 weeks. If the pain doesn't improve, we can do imaging, like an MRI, to check for a herniated disc.
That sounds like a good plan. Thank you for explaining everything so clearly.
You're welcome, Mrs. Johnson. Remember, always ask why if something doesn't make sense. Understanding the why is the key to your recovery. Let's follow up in 2 weeks to see how you're doing.